and welcome back to another episode. I'm your host, Dr. Nigar, and today we have an interesting topic to discuss that affects many doctors: the decision to transition from running a solo practice to seeking employment in a hospital. Today, it's just me on the microphone, but we will explore this topic from different perspectives. So let's dive in. Running a solo practice can be a challenging and isolating experience for physicians. As a solo practitioner, you are responsible for every aspect of your practice, from patient care to administrative tasks. One significant hardship is the administrative burden. Solo practitioners often find themselves juggling various administrative responsibilities, such as billing and scheduling appointments, which can consume a considerable amount of time that could otherwise be spent with patients. Another challenge faced by those running a solo practice is financial pressure, particularly in the early years. Setting up a practice requires significant investments, and building a patient base and generating a steady stream of income can take time. Moreover, solo practitioners may have limited resources and support compared to physicians working in larger practices or hospitals. This can make it more challenging to stay up to date with the latest medical developments and provide the best possible care to patients. On the other hand, working in a hospital setting presents its own set of challenges. When transitioning from a solo practice to a hospital, adapting to a new environment can be a significant adjustment. Physicians have to acquaint themselves with new colleagues, policies, and procedures. Additionally, the level of autonomy may be different. As a solo practitioner, you have complete autonomy over your practice, including how you treat your patients and how you manage your business. However, in a hospital, you may have to adhere to hospital policies and procedures, which could limit your flexibility in practicing medicine. Managing patient volume is another consideration when moving to a hospital setting. Physicians may be responsible for handling a larger number of patients compared to solo practice, which can be challenging, especially for those accustomed to providing more personalized care. When weighing the advantages and disadvantages, running a solo practice offers autonomy, giving physicians the freedom to make decisions about patient care and practice management. It also allows for flexibility in setting schedules. On the other hand, working in a hospital provides access to more resources, including support staff, technology, and medical supplies. It also fosters a collaborative environment, allowing physicians to work as part of a team. It is important to remember that every physician's situation is unique, and that works for one may not work for another. Sharing experiences and insights can help us make more informed decisions. Ultimately, whether to leave a solo practice and transition to a hospital is a personal choice and requires careful consideration of individual circumstances and preferences. Let's dive deeper into the topic by exploring some insightful comments we received from doctors on our platform on the same topic, that is transitioning from a solo practice to a hospital setting. One doctor comments, adapting to different patient types can be quite challenging. In a hospital, the patients are often sicker and require immediate decisions and utilization of resources that may not be as readily available in a solo practice. Another doctor writes, someone could ask you, why did you come late? Giving up some autonomy in decision making can be frustrating. In a solo practice, you are the boss and the schedule is set by you. You can arrange your schedule as per your family obligations. A lot of doctors also mentioned learning to work with a larger team of providers can be challenging. Another interesting comment we came across from a doctor says, your day-to-day, minute-to-minute decisions are no longer fully yours to decide upon. You now have hospital policy and procedures to follow. You must keep in mind the several colleagues working the same shift and work swiftly enough that you don't negatively impact the workflow. These are several things that private practitioners do not need to worry about. We are excited to hear from you and learn from your experiences. So please take a moment to share your thoughts and comments in the section below. Your insights will contribute to our ongoing conversation and help other doctors who are considering or going through a similar transition. Thank you for joining us on this episode. We appreciate your engagement and look forward to reading your comments. This episode was brought to you by MedSynapse. MedSynapse provides a space for meaningful discussions, networking opportunities, and access to valuable resources. Join MedSynapse today and be part of a vibrant community dedicated to advancing healthcare. Thank you for being a part of this enriching conversation. Take care and see you again.